I will begin by introducing Sahil, who is the moderator for the session today. Thank you, Sahil, for agreeing to do that. And then, so Sahil is a development professional trained in economics and public policy with a keen focus on gender development and human rights. He's worked with various civil society organizations on issues of sexual and reproductive health and rights, adolescent development and youth leadership, and technology for health and development. He currently works at the Packard Foundation in India and supports grant making, learning, and strategy for the reproductive health program's work. He also represents the Southeast Asia region on the Young Experts Tech for Health Global Council, advocating for greater youth engagement and empowerment in universal health coverage, and is also the vice chair of the Strategic Advocacy Committee for the PMNCH. So there could be no one better than Sahil to moderate this discussion. Thank you, Sahil, and over to you.
Thanks, Babita, and thank you to everyone who's here. Thanks to the panelists. Welcome to this panel on adolescent vulnerabilities and building resilient support systems. This panel seeks to provide a more intersectional understanding in the context of COVID around adolescent lives and vulnerabilities, presenting perspectives around sexual reproductive health, education, schooling and learning, and social inclusion and well-being. Adolescents are a historically excluded and underserved group whose challenges have been further exacerbated by the pandemic and its ensuing conditions. In this context, the panel also seeks to explore a nuanced critique of digital channels and spaces that have become an integral part of all of our lives, especially in the post-COVID scenario. While digital is a strong medium to support and enhance adolescents' positive transformations and experiences, there continue to be challenges around access, safety, autonomy, etc., leading to contradictions and new cleavages between haves and have-nots and a range between. This panel will explore a holistic approach to sustainable models going forward and the role of digital within them to connect adolescents with services and support and to build more inclusive structures and mechanisms that can address their vulnerabilities. Without any further ado, it is my pleasure to introduce the great lineup of panelists for this session. The first is Dr. Niranjan Saggurti. He's the Director of Population Council's Office in India. He's a public health researcher with more than 20 years of experience and has conducted diagnostic, experimental, and evaluation studies on health and development among various marginalized population subgroups, including adolescents and youth. He currently serves as a research advisor on several committees of governmental and non-governmental organizations. The next, Bishakha Datta, works on the intersections of gender, sexuality, and digital technology, and runs the nonprofit Point of View in Mumbai. She writes and films nonfiction and is perennially interested in what's not freely expressed. The next speaker is Prabhleen Tuteja. Prabhleen is a feminist activist with more than 10 years of experience with grassroots feminist organizations, youth-led spaces, and research-based programs and actions. Her work involves training, research, policy advocacy, and program management, and she has directly led and pioneered work on creating safer public spaces in Delhi and Jharkhand, and has worked on programs with a focus on violence prevention, sexual reproductive health and rights, and gender justice. Currently, as Director of Programs at the YP Foundation, Prabhleen works across thematics and supports in program management, strengthening partnerships and alliances, and contributes to staff mentoring and development across the organization. The next speaker we have is Neha Parti, who has over a decade of experience in education programs, and her core skills include educator capacity building, learning experience design, and program management. She considers herself an entrepreneur, developing pilots within organizations around facilitator development and 21st century curriculum focus on self-awareness, technology skills, and career exploration. She started her career in the CSR space with ICICI Foundation and currently leads the secondary school programs at Quest Alliance, working with a focus on adolescent girls. Welcome to all the panelists. Before I hand over to our presenter, I would request all speakers and participants to again have a go at the ground rules that are posted in the chat. And with that, I hand over to Niranjan to set the context for this panel.
Thanks so much, Sahil, and good afternoon, everyone. So at the outset, let me first say that these are, as Babita said, hard times, unprecedented times. And I wish and pray that all are safe and healthy at this time. All this while we are rightly so focused on the COVID management, and it is indeed equally necessary to discuss the adolescent health and empowerment, given the vulnerabilities that they experienced before COVID and now with COVID. How are these vulnerabilities have changed or further affected their transitions to the better adulthood? Let's look at some of the data about it. As a curiosity, I looked at the number of articles that were published on COVID-19 and adolescents since the start of COVID, because I just wanted to see where the priority is and how the priority is defined. Many of the deliberations, as we have been witnessing in the country and also globally, the programs and policies, they're informed by the published literature. And when I looked at the published work, just on COVID-19 and adolescents, it's only about 330, whereas in comparison to total articles on COVID, approximately 1 lakh in just 1 year time. That says the importance that we all have been giving to the discussion around the adolescents during the COVID era. Let me now turn to the basic content of the presentation or the context that I'm going to set. Most of the results presented in this slide deck, they are from the unique and longitudinal research that we conducted in partnership with Bill and Melinda Gates Foundation and Packard Foundation in the past 5 years, which studies the transition of adolescents. And the research included approximately 20,000 adolescents from a representative geographies of Bihar and Uttar Pradesh, who were recruited in 2015-16. And I just wanted to remind everyone that that's the year when globally sustainable development goals came into effect. So in this slide that you're seeing, for example, the educational vulnerability in Uttar Pradesh and Bihar for adolescents as they turn to adulthood, it was a huge. For example, you see that there was a sharp dropout from school after 10th standard for boys, but for dropout from school for girls starts as early as 8th standard. At every age, the gender gap exists in in school attendance, with girls at much more disadvantaged situations. So the gap that you're seeing between these lines tells the story of how much the girls are at a disadvantaged position, even when it comes to the school attendance per se, and the economic lack of interest in studies, all the school facilities. They were quoted as major reasons for school dropout when we asked them in 2018-19. That was the follow-up survey of the original survey. So the same Udaya participants, study participants who were recruited in 2015-16, they were contacted by our research team earlier this year, since we were hypothesizing that the last year's COVID may have had some influence on the education of adolescents, particularly for girls. The data in this slide clearly indicates that among the 10 to 14 year age group, age-old cohort, who were in school in 2015-16, that's the first column that in the blue that you're seeing, the dropout rate was much sharper for girls than for boys over time. And the gap in that dropout from school in 1 year has become almost double, as you can see from the 8.7 percentage points drop, the gap between boys and girls in the overall drop to the 15 percentage points. That's what this actually tells us the story of how much this COVID has an impact on the education continuation and further differentiation between boys and girls in terms of the education continuation. And last year, there was a huge discussion about education of girls via digital mode, and urban schools have actually started it there first, and then on teaching using the digital methods, and that the same was thought to be a game changer in rural areas. So there was television, laptops, mobiles, they became the key modes of that were used for the school education continuation last year. And our research of the Udaya study participants suggested that not many could afford to continue education via digital methods, particularly the children and adolescents who belong to most marginalized and low household economic status could not afford to continue education from digital media. Many reported of self-study and without a teacher. This suggests the influence of affordability for a significant proportion of the rural population. And I just wanted to highlight that fact that when we are talking about the digital methods to reach adolescents, we also need to consider the accessibility into the overall planning. And this data from Udaya study from the 2 rounds of survey that were conducted before COVID clearly highlighted that differential access to phone or even to internet between both boys and girls. The disparity is very stark at every age for unmarried and also for married girls when compared to boys of the same age. Specifically, when you look at the internet use, there is a huge difference, in fact, between both girls and boys. And one of the key points we all had was whether the ownership or access of phone has increased to girls, mainly because the continuation of education and phone was advertised in many of the media channels as saying that that is one medium that has been very useful for continuation of education in rural areas. So we looked at what was the situation, and that recent reporting from the field suggested that the ownership of phone has actually dipped among the unmarried girls to 9% for 15 to 19-year age group, from approximately 15% for the same age group in 2018-19. That you're seeing it from the left-hand side, left top corner of the graph. And this is not same true for boys. In fact, actually, the ownership of the phone has increased slightly, not so much, but increased definitely for boys for the same age group, the 15 to 19, when compared to the 15 to 19-year-olds in 2018-19. Perhaps the household economy and also that gender is actually playing this a role in differential access to digital tools at the household level. And this is the data that was released recently from the National Family Health Survey, and that was available for the phase 1 states and union territories. And the results have clearly highlighted that a considerable proportion of married adolescent girls, married adolescent girls reported that in the survey, they reported that they were either pregnant or already mothers. For example, in Bihar alone, if you look at the data from here, it says 11% of adolescent girls in 2019-20 reported that they had a pregnancy by the time of that survey. The point that I'm trying to bring in from there to here is that a considerable proportion of adolescent girls had a pregnancy. And when we looked at closely the Udeya data, during that same period, a huge proportion of married adolescent girls who had a pregnancy also had experienced pregnancy loss. For example, from this graph, you can see almost 1 in 6 married adolescent girls lost pregnancy before the age of 19 years. And almost 1/3 of the married adolescent girls aged 18 years in 2000, they were when they were in 2015-16, they reported a pregnancy loss in the follow-up survey, which is the age of about 22 years, the 34% that you're seeing. I'm comparing that number with when they were in 2015-16. So it clearly points out the reproductive risks that adolescents, as a result of the early marriage that's happening and an immediate pregnancy that is taking place. And you can see the in this slide, I would like you to see the right-hand side graph first, which actually suggests the effect of lockdown on contraceptive use among the young Udeya participants. We compared this data with the other data that was collected during the same time in Uttar Pradesh. And the data clearly suggested that in Uttar Pradesh, the contraceptive use went down from 18% to approximately 14% during the first 2 months of lockdown. And it was just an example of data from the Udeya. And now you see the left side graph, the data, which is the data from a study that was conducted in rural areas in 8 states and urban areas in about 9 states. And these data in comparison to NFHS4 for the same rural urban districts indicated a huge proportion of unintended pregnancies. For example, the unintended pregnancies in rural areas seems to have increased significantly from 13% in 2015-16 to 17% in 2020. Similarly, in urban areas, the proportion of that unintended pregnancies increased from 13% in 2015-16 to 20% in 2021. And imagine this data on pregnancy, loss, and absence of contraceptive services for adolescents. The proportion of the unintended pregnancies is another dimension of the reproductive health risk that I'm talking about when we're considering the adolescents. Not just the reproductive vulnerability, even mental health of adolescents has been a challenge both before COVID and also after COVID. For example, before COVID, there were a significant proportion of adolescents who reported the experience of depression or felt depression or hopelessness, at least frequently or sometimes. And with COVID closing down of schools, our colleges, financial constraints, and confinement to homes without friends have increased mental stress among the adolescents. And of the total, I'm just kind of referring back to the literature that I looked at online. Of the total 330 published papers on adolescents during the COVID, more than half of those articles, they documented how the mental health and psychological disorders of adolescents have further aggravated during the COVID. That clearly points out that mental health is one of the key priority areas of work for consideration in case of adolescents. And the other interlinked vulnerability refers to the nutrition, and the data that you can see here, and this is from Udeya data, the 2 rounds of survey that was conducted, longitudinal data, which actually highlighted that girls' thinness has increased with their increase in age, which means that as they move from adolescence to the young adulthood, there was more greater increase in the thinness, and also that the greater proportion of married girls, they became anemic from the first round of the survey to the second round of survey. As high as 1/4 of married girls, they were moderately or severely anemic before the COVID era. And there is an available evidence, unpublished from India, that the effect of COVID on nutrition of pregnant women and lactating mothers, and that's the results that which actually clearly suggest the effects of COVID. Next slide, please. And the one question that we had asked Udeya participants very recently, and that was that how did COVID-19 affect you? And majority of the younger boys, younger girls and older girls, and these are the age groups that we're referring to in case of 2015-16, they reported school closing and loss in education as the biggest concern. Whereas the older boys cohort, that was the 15 to 19-year-old cohort of 2015-16, they reported problem in getting out of house and employment loss as cause of concern. These results are clearly indicating the engagement of adolescent boys and our young boys in work activities, perhaps also due to the lack of education continuation or increased economic challenges at the household level. We don't have the clear evidence to relate directly, but that's something that is an indicator. And the reporting of these problems are also an effect, or it is clearly being the risk to their aspirations that they had. In Udeya, the most of the study participants reported in 2018-19 survey, including, they reported that they want to complete their education first, and that is not something that they are able to achieve. And clearly, there are indications that the aspirations of the adolescents in these states, specifically Bihar and Uttar Pradesh, are affected by the COVID. Not just about the older cohorts or younger cohorts, but in even the unmarried girls, or even for married young women. There is a huge challenge that, because in case of, for example, the unmarried girls and even the kind of services or the facilities that they used to get under the school health program or other governmental health programs, there are no education at school, no mobility, no access to the programs. And that's going to leave a further dent into the vulnerabilities of the adolescent girls. And in my last slide, I just want to put all this data into perspective, into the three domains. One, the pre-COVID, what we have learned from the Udaya study, that the girls' access to digital media has been a huge challenge. And many girls, particularly from Bihar and Uttar Pradesh, the married as adolescents had immediate pregnancies and experienced, many of them have actually experienced pregnancy loss. And more in-depth analysis of these data, they highlighted that early age experiences actually define their better or worse transitions. And with COVID now, and that's my second point in this slide, is the COVID now seems to have further challenged these transitions. Not that they already have some level of challenges with their transition, but now it's further challenged. And from the evidence that's available so far, girls are far more affected due to COVID, whether it is about access or about the sexual and reproductive health services. They are the most affected. Now, the third point and the last point, as experts are now speaking about COVID phase 3, which is going to affect the children and adolescents. And it's the time that we should start learning, taking the data to the stakeholders and policymakers about these 25 plus crore adolescents and their transitions. As the study clearly points out, that many of the adolescents who belong to the most marginalized population groups are living in rural areas. They clearly lack access to digital media and other services. And the girls are the ones who are mostly affected when it is about prioritizing the access, not just externally, but within the household too. And I'll stop here. Thank you so much for the opportunity to present.
Thank you so much, Niranjan, for setting that context and giving us a sense that while the virus may have been indiscriminate in its infecting, the effects continue to be felt disproportionately by certain groups, those who have already been vulnerable, which always has included adolescents, young people, women and girls, and others. As your presentation also notes, adolescents have been affected in many ways, limiting access to SRH information and services, disruption to education and schooling, worsening nutrition, increased sense of isolation and mental stress, and that even within adolescents, there are some segments who might feel these effects more intensely and more adversely. To unpack some of those perspectives and some of those dimensions, I would like to now invite our next speaker, which is Prabhleen, to share from your work at the YP Foundation. The YP Foundation engages very deeply and actively with young people, with adolescents in the communities, particularly around sexual reproductive health and well-being. If you could share what you've learned, what have been insights that you've observed in terms of the impacts on these accounts on young people, and probably also continue the conversation that's already begun around digital, how the YP Foundation and active engagement with young people is imagining the role of digital tools and spaces and media to engage with younger people and work towards their empowerment. Over to you, Prabhleen.
That's a lot to cover. Yeah, I think the evidence that Niranjan has shared does set a strong ground for a lot of narratives that we are also hearing for the last 2 years, completely unprepared the last 2 years. And often when somebody asks us how has COVID impacted adolescent and young people, because that's a question that is in a lot of people's mind, I always just want to tell them that it's the same way how we as adults felt when the first time, and now continue to feel when the states have chosen to chosen to what kind of information do they want to give to their citizens, when do they want to give that kind of information, and how they want to give that information, which has then further restricted our own mobilities as adults, and there is still no clarity on how the situation will improve, if at all, and the complete obliviousness of the impact on such restrictions on our economic, social, and health and well-being. I think this is how we've treated our adolescents for decades now. I think we choose most of the times the medium, the content as adults that we want the adolescents to know. In the last 2 years, as adults, we didn't have answers. So the divide for information to access for adolescents further increased in all its different ways. I think the experiences that we are hearing from ground on adolescent and young people has to be understood in different contexts, like you were saying, and like Niranjan was also pointing out. For some adolescents, when this entire phase started, I think it did bring up new kind of opportunities open up. They wanted to connect with families. Some of them went back and tried new mediums of leisure and entertainment. And some of them did get an opportunity to continue education in the digital mediums as we're speaking, which was then perhaps limited to, in earlier days, which was limited to 1 hour of computer class. Now they all had, some of them did have laptops, some of them learned on digital tools to continue their education. But that does not really talk about the entire spectrum of adolescent, and for many the realities look very different. I think soon, when the adolescents started realizing that this is not an early entry of their summer holidays, and the parents did not have a response which was definitive or trustworthy, they were only being responded in ifs and buts, and there was a situation of panic. For most of the situations started getting reactive responses. Priorities in the households were being set not depending on the actual needs, but really depending on what was deemed as immediate and as something that was unavoidable completely by the decision makers, which then completely often is devoid of any equitable share of resources in the household. In this situation, if an adolescent was even voicing the needs that they have, they were often contemplated for not understanding the priorities of the family and being self-centered or selfish in many cases, as we are hearing. I think taking a step further in sort of realizing the different realities, it is important to break the identity of young people as a homogeneous category and see the intersectionalities in this entire constituency and what we call as a demographic dividend now. In this situation, imagining an adolescent or young person who is perhaps gender non-conforming, and found a home to be the most unsafe space for them to share and express choices. We've heard situations where adolescent and young people have felt trapped and unsafe in their houses. The first day when the lockdown had occurred for adolescents, say living in disability, or the news and announcement was completely inaccessible for those living on street, for those who were living in villages where electricity is perhaps continues to be for on an hourly basis. There was a state of panic that got infused with limited or no information at all, which then further, that if you look into the spectrum of information and access, then even a lot of their other aspects of health and well-being continues to dip as they start navigating their life. For adolescents, for example, who had high dependency on schools and other services to avail menstrual or reproductive health and counseling products and sanitation facilities, this period led to an abrupt termination of access to sanitary napkins, IFA tablets, immunization, and meals, which also, of course, the data is telling us. In, I think, between last year and now, there has been a continuum in the mediated access to SRH commodities, which are stigmatized, and services that are often then being given by male members who might be going out now for procuring any supplies. They themselves also face hurdles sometimes from local authorities, in cases police, sometimes it's also paramilitary forces in some areas that we are hearing, who've regulated access while being completely insensitive to different realities. I think what is important is to also see is that there has been definitely a loss of millions of jobs and livelihoods in this pandemic period. What is unfolded gradually is also that there are many narratives of young people who were not on the map, who were not on the minds, and not on the stats either. For example, there is a reduced access to menstrual health and care for millions who were, on one hand, menstruators were unable to buy sanitary products because of erratic or no supplies, which continues even in the second wave. On the other hand, many have faced pressures because all family members were confined to home, and the stigmatized silence around menstruation, even as today we celebrate that day. Many menstruators shared shifting to different products depending on their financial circumstances and availability, which was not often their choice and preference. For some, a strict dictum that the male members should not be aware of their menstrual cycles forced them to perform regular tasks and obligations without prioritizing their needs. Making menstruation obvious to male family members is still considered a sinful act, if not less acquired punishments for adolescents, as we've been reported. Those of us, imagine, who menstruate our first few cycles, and imagine now an adolescent who's started menstruating now, I think it's with limited interactions with friends, with complete lockdown, and suddenly being closely monitored and not being told about the body changes without any stigma. I mean, this whole plethora really looks at very different and grim possibilities for adolescents per se. The challenge also escalated when it came to disposal of sanitary products, which had to be then done in odd hours and hidden to not catch attention of other family members. For those who had shifted to, say, cloth pads, who were often unaware of maintaining hygiene, faced infections. Which they could not speak about openly, and then that required medical attention, which was not available immediately. AFHCs were turned out to be COVID centers. There were, we know of counselors being then delegated for COVID care. So there was little information access, but also availability per se that got completely denied to adolescents. Also, to take a step further, I think for young LGBTQI people who got stuck with families who do not accept them for who they are, forcing them to relive past traumas and face more violence is something that we've been reported in the last 2 years more. There is an increased risk of experiencing gender dysphoria in the absence of medical interventions. While stay at home has been the mantra of the last 2 years, home is really a safe space for LGBTQI folks stuck in fearphobic, transphobic environments. There have been many young people who've reported going back to the closet. Some of them were forced to quit any form of gender affirmation in terms of self-identification and representation. For example, even the wearing an attire of their choice. Many of them who had returned back from their hostels were to their familial hometowns and home places, or who had lost their jobs and they were going back. They were cautioned to follow the code of the society and not bring shame, and asked to be ready if they do so, to face the stigma and being reprimanded. Um, Economic dependence, lack of privacy, risk of mental, physical, and sexual violence from family members has jeopardized the process of gender affirmative medical intervention for many trans young people and adolescents. This has triggered several physical and psychological repercussions, including gender dysphoria, like I was saying. But I think it's also important to see that trans young people who could not keep up with expensive and difficult procedures like this, in other cases, were also forced to quit by families, also, and in some cases have also become victims of conversion therapies. The pandemic, therefore, has led to inaccessibility of medical supplies and professionals. Any kind of confidential online consultations with doctors and psychologists was not possible in the vicinity of such family members. What you were talking about earlier in terms of, in terms of whether there is a digital divide, and I think there is nobody in the room who will deny that there is a gender divide when we talk about digital access. But the prolonged pandemic has also proportionately impacted both the access to sexual and reproductive health and well-being of adolescents in its different ways. There has been no clarity of plan and a clear long-term plan, which has added to the restlessness and anxiety among the young people and continues to do so. I think what we do need to understand is that this deprivation and marginalization is highest among adolescents who are further invisibilized because of their different identities. For example, we know that for young men who lost their jobs, the kind of stigma they faced if they were coming from a Dalit community was different from the kind of stigma and the kind of going back to, say, even education schools for young men and adolescents from upper caste communities, as we've observed in, say, UP. Um, we've often observed that in some cases the dependence on digital platforms for seeking information started increasing, but it also comes, we also have to be aware that because you're in lockdown, any access to digital platforms comes with a heightened surveillance and control, which impedes any kind of auditory, visual privacy and personal agency for adolescents. So the only legitimate access to digital platforms they had was, if at all, was for access to education, which was again in the surveillance of parents. But there has been a lot of young people who've been completely taken off of education, like Niranjan was telling. What is also important for us to see that it's not just the access to a phone, but it is also uninterrupted electricity. It is also uninterrupted data. It is also uninterrupted just also language, knowing that language and not being a barrier for all of that, then makes the digital space really accessible for adolescent and for young people. And in these cases, it is for unmarried adolescent young women, for queer and trans young people, for young people with disability. Some of these safety networks and support networks were completely inaccessible, both in urban and in rural areas. I think what is important really is to understand, for even at YP, for example, we've just now imagining a social action campaign where we could imagine like 5,000 people coming together is completely, like, it's unimaginable right now for various reasons. But now our own reach out to adolescents is decreased to about 5%. There are families with households with one mobile phone, so anyways the adolescent is the last person to get that mobile phone for their needs. We know that it is difficult in these circumstances where maybe the second meal takes the priority and mobile phones continue to be a luxury and the only form of digital technology perhaps that has mostly penetrated in the rural areas. What is important really is to see that to reach the last person in the room, it is perhaps important for us to be cognizant of the fact that if at all this digital movement continues, it has to move to a more equitable sense of access and not really limit itself to just having a technology in hand, but really making sure that there is supportive environment for that to guarantee that access. I think lastly, something that we've heard from a lot of young people is the fact that, especially in urban areas, that I will access internet, but what happens to my data? What if I say something? Will I get reprimanded? This heightened sense of also fear of what am I saying and who is seeing it, and how does that then impact me? Has also disallowed parents to give that kind of free access, but also for adolescent and young people to access it freely and like reach out to the kind of services that they would ideally like to reach out. So I think the fact that there needs to be safeguarding, it's not just about how many young people have mobile phones, if at all. It's really about how is the system prepared that this is something which guarantees autonomy and choice based information and access to young people.
It's very, very comprehensive and very nuanced. So thanks for taking us through what adolescents are experiencing and living. And thanks for also providing this segue to our next speaker. The next dimension that we're hoping to explore is education, learning, and we have Neha to talk about that. Neha, as we all know, millions of young people had to overnight acclimatize to learning on phones and figuring out technology and all those other constraints and challenges that Prabhleen touched upon and we've all been reading and seeing around us. In that context, and with your work within the education system and engaging with students within schools as well as outside, what does it mean? How do you think this disruption and the ensuing recalibration and challenges along the way have impacted adolescents? And again, just to continue the conversation on, we know the experiences have been a longer range. It's not been uniform for all adolescents. So maybe talking about gender, talking about location, talking about what digital even means as we imagine more resilient long-term education systems. So over to you.
Thanks, Sahil. And I think Niranjan and Prabhleen have kind of set a good context for me to kind of do a deeper dive in it. And I'll maybe start with the diversity that you were talking about. And a lot of what I'm going to share is coming from my experience of working with young girls and boys in government school setups spread across urban and rural areas across 7 states in the country. So just to give you like a glimpse of the kind of personas we have in our ecosystem. So there is a girl in Odisha who lives in a joint family. She has access to 3 or 4 phones with her through the day. So she has uninterrupted access to the internet as well. She has a lot of adults around her who are kind of supportive. She already is very clear about her aspirations. She wants to be a neuroscientist. So now she's utilizing all her time to read up about, science and how the brain works. And she's accessing more books, more YouTube videos. So that's one kind of persona that we saw in a place like Odisha and Bhubaneswar. On the other hand, we had someone in Karnataka in a rural district sending us an audio message saying that I'm getting very frustrated sitting at home. I don't know what to do. I want to make money. I have a business idea where I want to use the platform to kind of make art and craft material and sell it on an online platform. I don't know how to do it, but I really want to be productive and useful at this time. And then there was a third kind of a persona of a girl in Assam who doesn't have a mother. Her father's an alcoholic. We know that in the last year, Assam was flooded, so she actually she was cut off from anything else around her. She was dependent on her neighbors for food. She did not have access to a phone. So actually to get connected with her, we had to call her friend who lives next to her and then be able to speak to her. So that's the kind of diversity that we are kind of talking about when we are talking about digital access, or even the kind of environments and the support that these young girls and boys have. And now to kind of talk about the general context from our own data, we know that almost around 3,000 girls have gotten married in the last couple of months of COVID hitting us. All the girls have been engaged in, like when we asked them that what new things did you learn, all of them said cooking, hands down, and learning some art and craft kind of material. Some of them also learned skills like cycling and stuff, but they don't necessarily consider that as learning. So, and that's something I will talk about a little later. All of them were missing school, they were missing their teachers, missing their friends. Like Prabhleen was saying, that the house is not necessarily always a safe space, but the school kind of allows you that space where you can be yourself with your friends, and especially for girls in residential schools. I think for them, the life completely changed, going back to staying in houses with their parents. What was interesting was when last year when COVID had hit, children were automatically promoted. So what was interesting was that for those who were in 9th standard, they went into the 10th standard, and mentally they made a shift that I am in 10th now. And even though they did not have access to books and stuff, there was a lot of anxiety of the board exams, which still continues as we're talking about mass promotions. There's no clarity on how the markings is going to work. So that's also added a lot of anxiety to young people in terms of what is my future pathway, even if I want to continue my education, what does it mean for the choice of subjects that I take? So in that context, I think our program also had to pivot to using multiple strategies. Obviously, one strategy wasn't going to work for everybody. So some of the tools that we used was definitely WhatsApp, since most of the people kind of had WhatsApp, and that's where a lot of our student group kind of came together. We went back to traditional methods, a lot of one-on-one phone calls, a lot of audio conferencing happened using learning tools. We actually also couriered some material to students and then connected with them on the phone. Obviously, a lot of community connect models also. We also managed to do some webinars with them using Zoom, Hangout, and the IVRS as a system for sending out learning content and just information-related content. So I think it has been a mixed bag for us. Some of the opportunities that definitely kind of opened up with using virtual and blended models. One, I think because the learning kind of shifted inside the home kind of became your learning space. Parent engagement became easier. I mean, earlier we would struggle to get parents to school to come for a parent-teacher meeting. Now it was happening a little bit more organically, that if a session is happening, you know, the parents are peeping in. While Prabhleen said that there is a lot of scrutiny, that was also there, a lot of surveillance, but it also generated a lot of interest in terms of what are we doing. So we managed to do webinars around child rights and sexual health and having some of those conversations which are usually taboo around, you know, menstruation and what young children are going through at that time. And parents could listen into that. So that's something that worked really well for us. I think the other thing that happened was that because, you know, the home environment kind of, it's known. In school, when we talk about studying, there's a lot of fear, right, of giving the wrong answer, of making a mistake. Some of that also eased in an online environment. So while we were doing experiments, I still remember we were doing an experiment of invisible ink, and the girl just couldn't get it right during the session. She kept trying. Her mom was trying to help her, but she still couldn't get it. But then she called us back once she had gotten it, like almost after half an hour or an hour after the session was over, saying that I did it and I got it, and she sent a message on the WhatsApp group about it. So I think just that loosening of fear around making mistakes from a mindset point of view is something that we saw happen. When we do webinars, there are a lot more questions coming on the chat box. If this was a classroom situation and we would ask students to, you know, ask questions, obviously there's a lot of inhibition that is there. So we've seen some of that go down for sure. The other thing that we realized was that even though they had trouble accessing teachers, teachers, there were some teachers who were sending them material over WhatsApp, but because there was so much of a delay and kind of pause in the learning process itself, that, you know, they're sending material, they're sending them something back, there's no feedback coming in. Children kind of made their own local learning network. So they relied a lot on the adults who are not parents, but it could be an older sibling, it could be someone in the neighborhood, like the young bhaiya or didi. So we realized that that is also a very big potential when we're, and because these are usually older, adults, but not as old as parents and have access to digital devices, they could be potential kind of champions to work with young people and keep them engaged in this situation as well. The other thing that we saw was that a lot of learning became self-learning, became interest-based learning, became purpose-driven learning as well. And a lot of kids kind of started using the digital as a medium of expression. So when we did our sessions on menstruation or child marriage and those kinds of things, young girls came up to us and said that, you know what, we will make videos on this and we will circulate it in our network and amongst our friends because this is important and more people need to know about this. So we also saw those kinds of things happening. We had a girl in 9th standard who took a session on coding for almost 100 adults. And that would have been unimaginable, I think, like 2 years back, that a young person could do it, but she did it very, very confidently as well. And like I was saying earlier, because we went inside the home, we could bring in a lot of the context of the learners into the learning process. So the material that I was talking about that we had couriered earlier was actually to walk them through a design thinking process and actually do hackathons where they could build prototypes. And it's amazing the kind of solutions that the young girls have made. Somebody made a sanitary pad disposal machine, which is environment friendly. Because that's the problem that they are facing right now in their house. Somebody made a machine to help her mother pick stones from the rice, because that is very time consuming. So it has allowed for a lot of creativity to come out as well. And because our access to children is not mediated through schools, there is scope for much more experimentation to happen, much more integrated learning to happen as well. It gives us a window into the questions they are sitting on, which we can use as a learning tool as well. And the other thing I think it allowed for was just more exposure. So we were able to do role model interactions for these young girls where we had an engineer connecting with an Indian who is in Sweden right now, telling them what the country is like and what her work is like, to a lady who passed out from an ITI in Bihar. So it allowed for that diversity to come in the learning process as well. But I think it wasn't without its challenges. There were many things which we were unprepared for. For example, because now learning was happening through WhatsApp and WhatsApp access is mediated through adults, there were people who would share like objectionable material on the group. So there was like porn material shared on the group and now you don't know how to react. Now, what do you do with that child whose relative has shared it by mistake? What does it mean for that child? What does it mean for everybody else in the group? So having guidelines around that became important for us. Data privacy, we did not know how to control for that, because if you're bringing all these children together in one WhatsApp group, their numbers become shareable like with many other people who are in their family. So we had facilitators who were kind of being stalked online by adults, asking them for their number, commenting on their profile pictures and all of that. So what does that mean for the well-being of facilitators as well, who are, facilitating some of these interactions?
Neha, sorry, also just like time check.
Yes, I'll just take 2 moments.
Please do complete your thought.
Yeah. The other thing that we realized was that teachers are definitely not prepared for this. They were struggling with their own phone recharges, while students were also struggling with that. Teachers, again, had no idea about how to kind of, enable online learning, what kind of tools to use. And I think the last thing which is important from a challenge, or at least from a long-term strategy point of view, is one, the mindset shift towards just digital. Most of the times it is seen as an entertainment tool or something which is bad for young people. But I think like both young people and adults around them need to make a shift in terms of how they are seeing the device, which can potentially be a learning tool. It can be, it can allow you access to a lot of information as well. It can be very, very productive if you use it right. The second is, I think, just the mindset towards learning. Like I was saying, many of the students have learned new skills, but none of them count it as learning because there's no one validating it, right? There's no certification, there's no assessment happening around it. So what does that mean when people are learning on their own for institutional versus institutional learning, which is giving you a stamp that you've learned something and now you're like good at it. And last, I think, is just parents. There are parents who have phones, but they themselves are not digitally literate. So we have to account for kind of handholding of parents also through this. And if this is going to continue, which it will for this year and maybe partly in the next year as well, parents are going to play a more critical role. So how are we engaging with them along with focusing on the learner are just some thoughts that I want to kind of leave behind. Yeah. Thank you.
Thank you, Neha. And thank you for a lot of that which comes from your experience as well as what you're observing in the lives of young people and young learners. And that's a brilliant segue also to Bishakha. Bishakha, your work, and in your work, you've looked at digital very critically as a tool, as a space, as a way to reach out, but also to form identity, community, etc. And I know you talk a lot about safety, consent, privacy, rights, mindsets, do all of these things on digital. So just kind of handing it over to you from your work and your thinking, how is the way we are now engaging with digital going to impact young people, adolescents, and what do you think is the long-term paradigm to make this a space of safety, of empowerment, of moving forward?
Thanks, Neha. And thank you for inviting me for this. And I hope everybody who is here is doing as well as is possible in these times. I'm going to try and navigate this without repeating many of the things, because many points have already come up about the digital. So I think some of the things we've learned over the last year is, and I want to start by quoting actually a 16-year-old girl from a low-income community in Uttar Pradesh who said at one of our focus group discussions, "Mobile phone ke bina hum adhure hain." And I think what she's trying to say, in a sense, is what we've learned, is that in today's world, perhaps our old paradigm of the world as physical, with the digital just as an add-on, has become somewhat outdated, right? Perhaps we need to really start thinking about going forward with a paradigm of what I will call the phygital, right? Which is really connecting both the physical and the digital, understanding that while they are separate spaces, they also interact with and shape each other. And they sort of flow through each other and are tangled up, etc. And I think as part of that, I think we work with a lot of grassroots communities around India, and we actually do digital literacy, security, and rights workshops with them, right? So because we had been doing this earlier, we were able to take these online, although very similarly to what Neha described, combination of WhatsApp, voice, teaching them Google Meet, etc. But I think one of the things that they've all realized and which we've learned is that the mobile phone, in a sense, has now become a resource, right? So when we used to talk about low-income or tribal communities, we would often say Jal, Jangal, Zameen. But now we've come to that strange place where we have to say like Jal, Jangal, Zameen, ... other things and mobile phone. Because as all the speakers have pointed out, in today's world, without access to digital technologies, etc., you don't have access to many other things, right? And I think, again, we saw this right across. I'm not going to repeat those examples of education, information, etc. But I do want to say that not having access to these leaves you at a huge disadvantage. And I want to also say that I think there are some ways in which we think of mobile devices or digital devices as tools, like for education. But there is also a way in which we need to think about them as spaces, right? When for connection, the Angan Trust did an interesting study with 255 adolescents last year, where they found that the use of mobile phones had really changed from purely entertainment to, things like connection, alleviating loneliness, etc. And they found that, a significant percentage of the young people they'd studied actually said that they were more comfortable with mobile phones, while about half said they were comfortable with physical spaces. So I think the important thing is that to really think about this as a space. And I think going, back to the point of why is it such an unequal space, right? Beginning with the data that Niranjan presented, I think we need to, going forward, really think about the gender norms that underlie this space. That is actually what is resulting in what we are basically seeing is that gender norms offline in a patriarchal society are essentially moving online, right? So in an earlier age, we had girls in low-income families get less access to nutrition, to education. If we add the mobile or digital devices, now that's one more resource that they have less access to. And this is again because of gender norms. But I think what we are finding from our communities also is that a lot of the gender norms are tied to sexuality when it comes to digital devices, because there is a perception in rural communities, etc., that this is sort of a dangerous device, and that if this is given to girls, particularly adolescent girls, they will make their own sexual choices. In short, they will choose their own partners. They will literally take advantage of the mobility that these devices offer in a context where they don't have physical mobility. So there are many such norms underlying, this kind of what I would call digital. There's a digital gender gap, and then what we are seeing at the family level is actually digital gender discrimination. Because even in a family where the girl, adolescent girl doesn't have access to this critical device, her brother often does, right? So I think, again, if we look at it again through, I'm going to shift the lens a little bit, and if we look at it through the lens of queer communities in India, we found over the last 10 years that many queer communities, which are started by individuals in the sort of late adolescent age group, have started online first. And they've started online first mainly because in smaller cities, towns, etc., it was physically not safe, right, to start these communities. And again, when we look at it through a queer lens, digital spaces, again, are not just tools, but they're also safe spaces where you make the queer visible. There are spaces for movement building. There are spaces for counseling, right? Like there are many groups that counsel each other on WhatsApp or WhatsApp services, etc. There are spaces for coming out, building relationships which may be stigmatized in their communities, etc. So we, one of the things that we found, which is similar to what I think Neha referred to, or one of the speakers, is that in a context where you're stuck inside the house, right, in a pandemic context, and it's not safe to physically meet, that connection becomes even more important because that's the only connection you have. But at the same time, there have been many cases actually of queer individuals who have left their phones lying around somewhere in the house and have inadvertently been outed to their families, queer and trans individuals. And that has led to a certain kind of violence in the home as well, which maybe hasn't been recognized as much as it needs to. So a couple of things, since we're talking about violence, one of the things I wanted to talk about is if we really think about digital devices, not just as devices or tools, but as spaces, then it's critical that we make these safe for everybody who inhabits them. And in that context, what we're hearing from adolescents in rural and urban low-income communities, where they might have a feature phone, the old type of phone, or a smartphone, is that they are getting a lot of harassment through WhatsApp messages, like a very typical, unknown number, hi, how are you, who are you, etc. They're getting phone calls, repeated wrong numbers from unknown numbers, the person not talking if somebody else in the family picks up the phone, but when that adolescent girl picks up the phone, again, the same person comes back. They are finding in certain cases that there's a coming together of online and offline. So, a caller might actually call up and say, basically say, this is the address of your house, this is the time you go to school or college, sort of has information about them. So very complicated mesh of digital and physical safety, privacy, all of that in the same basket, right? And I think we're also seeing that, adolescents really don't know how to deal with this. They are trying their level best with whatever homemade strategies they can muster up, whether it's turning the phone to a male member of the family, threatening the caller that we'll complain to the cyber cell, etc. But enough attention hasn't been paid to their sort of need for safety. And they are not aware, for instance, that they can also report to some of these platforms. And a very, very big fear is that they cannot talk to their families about what they're undergoing because their phone may be taken away. In some cases, when they've complained to parents, etc., they've been told, well, change your SIM card. So young women are like, why should we change our SIM card, right? And again, I wanted you all to think a little of the offline parallel. and how in cases of gender-based harassment, abuse, and violence offline, often the recourse given to the adolescent girl is like, to essentially kind of, it's protectionist, it's blaming her somewhat, it's saying you have to change your behaviors, right? But not really giving her that kind of safe environment that she's looking for. So I just want to end actually by saying that lots to talk about, but I think perhaps going forward, it's important for us to really think about these two domains coming together and really sort of plan for the future where we can give adolescents, particularly adolescent girls, sort of a, rights, safety, security, and freedom, essentially, in both these domains. Thanks. Yeah.
Thanks, Bishakha, and thanks to actually all the speakers. We've been able to chart a very expansive contours of adolescent vulnerabilities, their lives, their well-beings, their realities. And thanks for kind of ending it in a way where we now see how digital becomes not an add-on, but enmeshed into the adolescent framework of well-being and vulnerabilities. So thank you for that. To give a summary to the panel, I'd like to now invite our last discussant, our commentator, Priya Nanda. Priya is a senior program officer with the Gates Foundation India, where she leads measurement and evaluation for social norms and equity. Prior to this, she was at the International Center for Research on Women, Asia office, where she led a portfolio of research on measurement and evaluation on women's economic empowerment and reproductive and sexual health. She has also been the co-director of an ODI-led research consortium on gender and adolescence. And Priya goes by the tagline, she who knoweth not, but knoweth a lot. With that, I'd like to invite Priya and ask you to give your thoughts, a summary and reflections on what we've heard and how we make sense of this.
Thanks for taking on the challenge to pull together this panel and all of the panelists. On behalf of Quicksand and Cornet, I was very excited that all of you would come together. I had a bunch of keywords that I had prepared. I didn't have any great comments, and it is pretty redundant after what Bishakha said, but at the risk of repeating, but just kind of being a little flippant, but serious too, I would like to say, like, what I was thinking about this morning was, the point that Bishakha really made about the phygital. I love that language, but basically how digital has both forced us in a way to connect with imagined spaces and territories and thoughts and ideas that otherwise was not possible. A person located in Timbuktu can actually co-organize and co-convene with somebody sitting very, very far in Papua New Guinea, for example. So it is a kind of connections that can be fostered are really quite amazing. And there's a lot that we can do to leverage and harness that. And, so this, for me, digital has a bunch of words, which I'll just say right now. There's transmission of signals, information, content, transportation, as Bishakha also talked about, the ability to connect, convene across the globe, co-organize, to connect, to find safe spaces, which were otherwise physically not available. There's obviously transgression. There's also transformation, which is the whole point that we are discussing. Is it transformative, and how do we enable that? And then, of course, now, like, more about trans inclusivity, right? We're not just talking about heteronormativities, or we're not just talking about binaries. We have a lot of, we need to think in much more complex and complicated ways about digital. So I think the panel really brought home for me all of these issues. I think the thing that didn't get discussed, and I was hoping, Bishakha, you might pick up that point, was about data. And I think it is so topical that I almost hope that somebody would talk about what does this mean today? What is today the situation of being connected and being reliant and over-reliant, over-surveillant, celebratory around the access and potential of digital? What does this mean today for our data, for protectionism? Is protectionism necessarily disempowering? Do we need to think about a new framework where we talk about protection and privacy and rights in a much more empowering way? So this is what I would, and I think Bishakha, I'm sorry because you ended in the end, and really I'm just such a fan of the work you do, but the work that you do on digital security, rights, and internet freedoms, I think that is really where we need to land today. While we can bemoan that there is a huge section of our society that do not have access, but I think just the way the pandemic has changed everybody's lives, I think 2 years from now, we will be catapulted into a world where there will be more digital access. So we need to prepare today adolescents for that time 2 years from now. Instead of only talking about the deficits and divides, what we need to talk about is how do we catalyze, build partnerships? How do we actually, there are a lot of SRHR services and service providers and organizations that aren't connected with the work that, for example, that is happening in the education sector that Neha talked about, or on digital security and freedom. So we really need to kind of interlock and interconnect these worlds. And I think that it really, I mean, as a donor, Sahil, I think you would agree that I think it also behooves on donors to really kind of be more creative with how we are thinking about funding and how are we thinking and imagining what resilience for adolescents would look like in a post COVID world. I think that it is almost unimaginable to take out the digital space when we talk about resilience. But then if we go much more into conventional definitions and thinking around resilience, it is also about creating communities. And those communities that we are creating have to be empowered both digitally, but even in the offline and the off digital spaces. So I think these are really my comments. I would really like anybody to take on maybe in the next few minutes a reflection on what does protectionism and empowerment mean today for adolescents, especially if you are confining yourself to thinking more digitally. And I don't know if Bishakha, Neha, anybody who wants to take this on.
Please go ahead and unmute yourselves, turn on your cameras. I think this is open and I imagine all the panelists could weigh in. So I think that's the question that we have. Bishakha, you want to start?
Hi, Priya. Yeah. Well, let me try. It's a tough question, but I'm hoping all the panelists will actually, I think maybe with the question that you talked about, like the data thing, etc., right? I think what is very odd is that we are living at a moment in time where we are going closer and closer to the digital, even as it is actually from a data perspective, becoming a more and more dystopian space, right? So we often find ourselves, and I'm sure like others do as well, is that we are, particularly when we are working with grassroots or community-based groups, we are having to use exactly those apps like WhatsApp, or like Facebook, etc., which are familiar to these communities, but which are actually, in a sense, the most sort of data extractive. I think the second dilemma is, how do we actually explain these concepts to grassroots communities, right? To young women. So all of these things are, I just wanted to, since you sort of brought that up, deal with that. I think we're just at a very complicated crossroads. And I think the feminist understanding increasingly is to treat the body itself as data, or as an extension, the extension of the body as data, and to sort of question whether the body today actually ends, where the skin touches air, or whether because of the amount of sort of our desires, our pleasures, our likes, our personas, everything being gathered by machines, what do we even think of the body? I just wanted to sort of throw that out, because that's sort of conceptually where the discussion is going. Very hard to sort of resolve, but really to show how much things are actually changing as we reconfigure sort of this digital and physical.
That's really profound. I'm still thinking about what you said. I think it is true, because in a way, what we are thinking about is a lot of censorship almost should happen here before even the signal begins to transmit out of the body, right? But that means that that level of empowerment or thinking or astuteness has to be very high. And of course, the fear of what might happen if it doesn't is very, very rampant right now, right? Because there are so many layers. I don't know, Neha, you talked about, it seemed to me you talked about urban poor contexts where actually children had a very positive and affirmative learning experience. And I really liked that because it just made me feel happy in this time. You talked about self-learning, you talked about imagination, but I wonder if there is a grim side to this, or there is something much more pensive that you are thinking about as an entrepreneur, as you're thinking about the space, especially in light of the discussion we just had.
I mean, apart from just the access challenges that come and the gendered dimension to access that comes, I think we're still kind of, at least in the space of education, when it comes, as we're talking about, say, learning also moving digital, there's still the divide that we have about basic literacy, numeracy kind of skills. So even if you have access, how are you, enabling yourself to make sense of all the information that is going to come your way, right from being able to read it to being able to comprehend and make sense of it as well. So that's definitely something. And increasingly, we also have kind of young children asking us, right, that there's so much information that is being put out there. How do I decide what is right and wrong? So I think like Bishakha was saying, that how do you even, engage young children in conversations of right and wrong? Which can kind of take moral dimensions as well, which can go into like value systems that we kind of abide by as well. So I feel like we have to bring in a lot of these conversations into our learning processes. And what you were saying, I think we're really preparing them for the future, like 2 years from now, when this is going to become like more and more the everyday reality for many more people. How are we kind of, and I think some of the fundamentals remain the same, that when you're talking about education, it is really about building a critical thinking mindset, which becomes even more important in today's context. So what does that mean in a digital space also then becomes a question for us to kind of engage with. And many of them are already seeing, I think like along with the data protectionism is also this whole thing of fake news and just misinformation which is going out there, and how that is shaping narratives. And sometimes it's really scary that how fast young children are picking it up as well, right? Like whether it is what's happening with other countries, or whether it is just what is happening inside the country as well. So I think for me, one question which I'm sitting on is also, what is worth learning and teaching anymore in our school ecosystem in today's context, right? And there's so much conversation which is happening about learning loss, but whatever was supposed to be learned, whether that was worth it. So is also a question which we should be, I think, asked. And now is a good time because we can really, really kind of revamp a lot of things. But unfortunately, I think we're still kind of looking to just mask and make very superficial changes rather than asking ourselves some fundamental questions.
Great. Sahil, I have a quick one for Prabhleen and maybe Niranjan, and then I'll give it over to you to sum up. So Prabhleen, I was just thinking about in today's context, given everything that you said, how do organizations like YP feel empowered? In terms of, just kind of the massive agenda that you have and all the deprivations and issues that you talked about exclusion. And on one hand, all the language that we are all evoking through our SDGs about universal access, rights, the SDGs, which we know we'll never get to by 2030. But obviously, there is an aspiration for organizations to organize themselves differently, right? How are you thinking about this strategically in the next 2 years, for example?
I'm glad you're also thinking of 2 years. I think the challenge really is what is happening, I think, next week. I think that's where our realities are. And that also, I think that's the power that even digital platforms have given us too, that you have the capacity and capability to be dynamic and to explore different mediums. But for us, what has been, and I agree that, and it was heartening to see the examples that Neha had talked about, but personally, I think what we have felt challenging is there is a surveillance that happens. So while yes, education is then seen, and there is a gender lens to the conversations that are then seen as something that adolescents can have, which Bishakha also talked about. So for example, for us to do comprehensive sexuality education sessions in households was not possible. What we did finally after doing 2 or 3 sessions is then we sent out earphones to adolescents adolescents who were recruited in the program so that they could hear. What the other thing that we did is that we did use chat, but we also started, because a lot of parents could hear the facilitators, then a lot of the questions that we were asking were then becoming objective type questions. So we were not asking them what is your choice of contraceptives, we were also giving out the choice of contraceptives and asking them, you vote between A, B, C, D, and they only had to say A, B, or C, or D, and not really voice out the option that they really would like to choose to protect their confidentiality. So I think the challenge really is that a lot of our language, a lot of the content that we are giving, while we know that adolescents might get prepared in the coming future, we have a lot more to cover in our own strategies. The second thing, both as, and because you said for the funder world and you talked about it, I think the second thing is how are we resourcing these communities? Is there the possible, because it is not stopping at access to the mobile phone. Data pack recharges for adolescent and for young people is not the reality, at least in terms of the needs that are getting that are being hierarchized in the family. Is there the possibility to think of different kinds of resources that actually the communities would now need? What would that mean for programming then, and for us, and how do we create that divide? But more importantly, I think what I am left with always is, what is the impact that we will now be able to measure? Will that only be limited to information and access to more information? If not, how do we actually measure perspective change in these spaces, which, because we know that these spaces will have, at least for the few years, will have restricted surveillance, and there will be a lot of gender disparity that we will see. So what should we expect out of adolescent programming, and how should we leave it only at information gathering? If there are alternatives, what would that mean? And we are struggling with it. We're trying our own different ways around it. And the second important real thing is that what would be the sustainability of these models today, as organizations who are in this, because we immediately changed our scope of work. Today we are able to do this. Will we be able to continue, or when we leave those communities, will this model be a sustainable model for the adolescent and young people, and will that access not change in any of its form as programs take a different shape, form, and size in different contexts?
Great. So, Neha and Bishakha, you both had questions. I see you're responding, so I won't repeat them here. Please do respond. Otherwise, I'll give you a minute to wrap up after. Niranjan, are you there? Could you respond to the question based on what data you presented? And then you heard this discussion, especially like it went from very, very prosaic to very profound to very esoteric issues. What do you think from the council's perspective should be the future evidence agenda? Like, what are the 2 or 3 things that you think that we must start collecting, doing research and collecting data and insights on?
As I think many of the panelists have already pointed out, one is the diversity and the equity that in the digital access that exists out there. We don't know enough in terms of the diversity in the access, diversity in the use, diversity in the abuse. And a lot of the literature that, this whole pandemic situation and the digital, outburst on adolescents in some ways, but digital development in positive way has happened suddenly, all of a sudden, to the adolescents. And that because of that, there is not enough preparedness even at the adolescents level to manage, cope, and to effectively use it for the development. A lot of the literature outside India, not in India, and we don't yet have the data to suggest, a lot of the literature outside India actually talks about how the adolescents have to experience the abuse, and also at the same time digital misuse. And what does it mean for further development from the health and empowerment perspective? And that's something that we need to have more data, more evidence to all the points. I mean, great points that everybody made on the how are we going to be the digital. My only point is that while we look at all that digital ways to reach, equity must be kept into the close consideration, and look at that to make sure that everybody have the access, and also that everyone's digital access actually is helping them for their transition. So there is a so much need that exists out there for creating the data and evidence around what we should be doing as a next stage of this process. Thank you.
Great, Niranjan. So over to you, Sahil. I think what I'm really leaving with is like the thought that was a panel on adolescents, but really where we are landing up is, how does digital enable us to be a much more just and inclusive society? And in a way, adolescents are actually going to be the big movement that's going to help us shape that. They're not just subjects of interventions. They are people who are going to help us shape a much more just and inclusive society. So I think everything that we are doing is a contribution in that way. So that's what I'd like to kind of end with. And over to you, Sahil.
Thank you, Priya. Thank you to all the panelists. I would have tried to cover and capture, but I don't think I can. I think this has been an extremely rich conversation, very nuanced. It's traveled all over the place, as you said, but I think, and I hope it's leaving all of us with a lot more food for thought, a lot more nuance, a lot more critique, and more work to follow. I would like to, at this point, I know we're over time as well, thank everyone for a great panel, the panelists, the anchors of this session, Pop Council, for making this happen and working to conceptualize this, as well as the CoreNet community for sharing their resources and participating. Thank you so much, and over to the CoreNet team.
Thanks, Sahil. Just wanted to say thank you again to all the speakers and Priya for posing those questions in the end. Leaves us enough food for thought. And Sahil, thanks for stringing it together and possibly connected to a lot of the questions that were raised today towards the end. We have the final panel of the CoreNet conference on the 10th of June. It's around the future of data ecosystems and particularly the role that communities and individuals play within that. If there's anyone here who'd like to know more about the CoreNet community, please reach out to us at hello@CoreNet. Thanks once again, and hope you all stay safe. Thank you.